Welcome into a business spotlight for Morris Hospital on this Friday. As the topic for today is going to be distracted driving. We're joined by Dr. Kristopher Oswalt, trauma surgeon at Morris Hospital. Doctor, thanks for joining us.
My pleasure.
So distracted driving, it's something we hear about more and more as more folks have smartphones, more folks have things in their car that might take their attention away from the roadway, and it's obviously a big problem. We want to kind of focus on distracted driving, let folks know what it is in case they're maybe not as familiar with some things as they could be, hopefully within the next 5 minutes, and some things we can do to hopefully have folks not be distracted when they're driving. What are some of the main types of distracted driving?
There are basically three main types of distracted driving: visual, manual, and cognitive. The visual means you're basically taking your eyes off of the road. In the manual example, it's physically taking your hands off the wheel, doing other things. In cognitive, where you're just taking your mind off of the driving and not really paying attention to the road. Some examples of the visual and manual type include talking on the phone, texting, dialing, possibly entering information into navigation system or GPS, or changing songs on your MP3 player or even the radio. Even people that try and eat on the go with their busy lives can be distracted as well. For example, unwrapping food or spilling coffee or soda on yourself while you're driving. So this can be a big problem. In fact, drivers who use handheld devices, for example, phones and things, are approximately 4 times more likely to get in crashes and seriously injure themselves than driving, paying attention to the road. While they're sending and receiving text messages, even you think sending a simple text message is not a big deal. However, sending a simple text message on average can take about 4 to 5 seconds, and that amount of time taking your eyes off the road can be the same as driving the distance of a football field without even paying attention or knowing what you're doing. The final type that I wanted to talk a little bit more about was the cognitive example, and these are more from even talking on, even through the handheld device, having conversations. Your mind's not focused directly on the road. You're talking about other things, or people that if you're overly tired as well is another example. So all these instances can lead to fatalities, and a lot of people get hurt from doing this. So it's important that we bring this awareness to the public to make them aware that how valuable it is to really pay attention to driving when you're on the road.
Yeah, I'm sure in years past, drunk driving was probably one of the main reasons for accidents. But distracted driving these days has to be right up there, right? If not the number one.
Especially with all the technology we have these days. I can give you some statistics on that.
Sure.
In 2015, there were approximately 3,500 people killed in crashes involving distracted drivers, compared to around 3,200 in 2014. So the number is definitely going up. There's approximately 400,000 people injured in 2015 as well, involved in these types of crashes.
So where are we at these days with laws trying to prevent distracted driving? What should motorists be aware of?
In Illinois, currently, there's a ban on all cell phone use, handheld and hands-free. This is for bus drivers in particular. There's a ban on cell phone use, handheld and hands-free, for novice drivers. These are for the teenagers under the age of 19, in fact. And there's a ban on texting for all drivers. And in fact, there's a minimum fine of $75 if you're caught texting and driving. And Illinois does ban the use of cell phones while driving in school zones as well, or highway construction zones.
Well, and as we mentioned, you are a trauma surgeon, and we're talking now a little bit about the hospital and the Level 2 Trauma Center, the capabilities that you have there. What can you tell us about what you do in the Level 2 Trauma Center?
Okay, so there's emergency rooms, emergency departments treat ill patients. Trauma centers handle most severe, life-threatening injuries, including blunt force and penetrating traumas. At a trauma center, there's a sophisticated, highly trained, interdisciplinary team of healthcare professionals that take care of the patients. They dedicate extensive staff, physician, faculty, resources so that seriously injured patients have the best possible chance for survival. In fact, seriously injured victims that are treated treated in a trauma center have approximately 25% risk lower death than at a non-trauma center. At Morris Hospital, we're a level 2 trauma center. There are level 1 and level 2 trauma centers. Ours is a level 2. At a level 2 center, we have to have 24-hour availability of essential specialties and equipment, including emergency room services available 24/7. Level 2 trauma centers also have physician specialist coverage, including myself and the other trauma surgeons that were available 24/7 as well. We have to be able to provide critical care for our patients through the continuum of their hospitalization, so not only once they're seen in the emergency department, once they're admitted, we're able to take care of them. So the hospital itself has to go through a stringent set of performance improvement programs to maintain this level 2 capability to take care of these patients. So it's important for us to be a level 2 center to be able to serve our community and help these patients when they do come in.
Yeah, and hopefully there aren't many of them that do. It's one of those, we don't want you to be too busy dealing with these trauma situations and distracted driving. It's one of those things, people know it's bad, but they still do it, and you hope you can try to minimize some of that, but folks are still going to do what they want to do. Hopefully some of our listeners are thinking twice about, answering that text when they're driving. Just wait. However long your drive is, it's not worth the risk.
Absolutely. Thanks for having me today. I really appreciate it.
Dr. Oswalt, thanks for your time. Trauma surgeon Dr. Kristopher Oswalt from Morris Hospital here on WCSJ's Business Spotlight.